My name is Dr. Herry Mapesi. I'm a physician and a researcher, and I work for Roche Diagnostics. My role, I lead medical scientific affairs for Africa sub-region. Well, hepatitis, in the simple language, means inflammation of your liver. And to put it in the perspective, the liver is one of the biggest glands that you have in your body as human beings. And it has more than 500 functions that it do every single day. Now, what is hepatitis? So after the inflammation of your liver, there are so many things that can cause this inflammation. For example, excessive alcohol intake can cause your liver to be injured. Another reason could be drugs. There's some drugs that people take. Excessive drugs can also cause injury in your liver, because one of the functions of the liver is to detoxify your body. Then there's viral hepatitis, and these are the type of viruses that they cause injury to your liver. And we have 5 of them: A, B, C, D, and E.
Which one is the most prevalent in the country?
Well, that's a very good question. So first I would go for the way these viruses are transmitted. So we have hepatitis A and E, and these are transmitted through oral fecal route. And this means you eat contaminated food or you drink contaminated water. So these are A and E. And then you have B and C. First, A and E, this causes acute infection, and usually within 1 to 2 months, our body can clear them up. Now, we have B and C. These 2 strains of the virus, this can stay longer in our body, and these are the ones mainly can cause you, after a couple of years, to develop fibrosis. That means your liver now becomes smaller, and then later on, liver cancer. And then just a couple of weeks ago, the WHO, or the World Health Organization, has just announced the variant D, which usually you only get it if you have hepatitis B. So D and D and B, they go along together. And this one also was classified as it can also cause liver cancer in the long run, because from the research, we saw that if you are infected only with B, and if you are infected with B and D, the risk of you developing cancer at the end of the day, after a couple of years, if you have B and D, you have 2 to 6 more times risk of developing cancer. For the 800 cases that you have mentioned, when I look at the literature, or when you look at the numbers in Kenya, actually, it estimated around 3% of the population, and some numbers that they go up to 4.4% of the population are infected, and this is hepatitis B. And this is chronic infection. That means these people that have been infected with the virus, and they couldn't clear the virus, and they've been having it for it could be many years. And for hepatitis B, for example, one of the most route of infection, or the source of infection, is from mother to child, and this is during birth. Basically, during birth is when you can have this infection, because that's when the blood can mix between the mother and the child. And unfortunately, 90% of these infants who are infected during this time might develop cancer over time if we don't do several measures. And one thing I wanted to call out is, if, for example, a pregnant woman, let's say you go to the antenatal clinic now, and then you do your test. It's very common to do HIV tests. It's very, like, a pregnant woman will ask the doctor, can I have a HIV test? And it's very common, or syphilis. But still, hepatitis is not very common, especially hepatitis B.
Let me take you back a little bit. I think you lost me somewhere. You mentioned hepatitis B can be transmitted, if I'm corrected, from mother to child during delivery, and that this can be stopped during the antenatal care. Kindly just clarify a little bit that. Let me understand a little bit of that. Explain further.
Yeah. So for hepatitis B, one of the most common route of transmission is mother to child. And it's quite different with hepatitis C, but this we can discuss afterwards. Now, let's say a pregnant woman nowadays, if you go and then you start your antenatal clinic visits, on the first day, it depends on the hospital, of course, that you go, but usually they have screening of the diseases, and this includes, for example, HIV, includes syphilis, is also pretty common, and some clinics, they do hepatitis surface antigen. That means they look at hepatitis B virus, if the woman has or previously was infected with it. Now, during the third trimester, let's say you are positive. Let's say we just said, oh, you have the virus, right? So we can measure afterwards how much of the virus do you have in your system. Because we have a threshold where we say, okay, this is lower, so probably the viral load is small to be transmitted to the child, but sometimes it's pretty high. That means you have a lot of virus, let's say, in your blood. And then what will happen is during third trimester, we can give you medications that can hinder the replication of the virus. So that means you will have a lower viral load by the time you give birth to your child. That means the risk of you infecting your child become lower. And then within 24 hours, when your child is born, we can give him or her hepatitis B vaccine so that we can prevent the infection to this infant who is born. From several studies that we see, we know less than 20%, mostly in mostly countries in Africa, people know if they have the diseases or not. And that's why we emphasize on diagnostics, early diagnostics, early diagnostics. So a woman will go to the hospital and they will talk about HIV, or they can request HIV, but not hepatitis. But I give you another epidemiological numbers. In the world right now, we have more than 300 million people living with chronic hepatitis B and C, more than 350 million for these two diseases. And we only have 40 million people living with HIV, but people talk more about HIV compared to hepatitis. And we know more than 1.3 million people die every year. That's more than every 30 seconds we have somebody dying from hepatitis. But we don't really talk about it more. And that's the call, for example, from us also as a company, or from the work that we do, for example, in Kenya, really is emphasizing people need early diagnosis. Because for hepatitis B, if you go, you do your test today, and then you're negative, we have a vaccine that we can give you, and then it will protect you for many years afterwards. For hepatitis C, which also can cause chronic illness, if let's say you go and then you get tested for hepatitis C, and then let's say you see you are infected, we have medications which we'll give to you, and then within 2 to 3 months, you can clear the infection.
Probably a mother might ask, is it really important for my infant, and how dangerous is hepatitis B to my infant when it is transmitted? Because a mother might wonder, I've lived all my life, I have never had any signs, I've never felt sick about it, I don't even know it, so why bother with it when it is not affecting me, and how is it dangerous to the infant?
Yeah, I mean, that's a very good point. So when you look at the data that we have, for example, for adults, usually it can take up 10, 15, even some people 20 years for you to start developing the symptoms when you're infected with hepatitis B. So it can be longer. That's why we call it a silent killer, because you won't develop any symptoms. Now, for children, it's quite different, because what we see in the data, if an infant or if a child is infected during birth, that is, let's say during birth process, the probability or the chance of them developing the chronic illness, which for others can take you 15 to 20 years, we see more than 90% of them, they might develop this chronic illness, and that means they can develop, the risk of developing liver failure and liver cancer is pretty high for the infants, because they will live with the virus for a very long time.